Hey mamas, it's your CajunStork here in Midwife chiropractic here called the Natural Birth House. I'm located in Broussard, Louisiana, but don't let that fool you because I also serve Lafayette, Lake Charles, Homa, and Alexandria. So in the meantime, I'm going to give you guys a tour, but let me know that you're watching by letting me know down below where you're from. And bear with me a little bit. There's a lot going on here at the birth house. I'm a little nervous. I've never done a live video before. We have our babies here, and so just bear with me. So this is our waiting room. Midwifery care is really, really different than OBGYN care, and so I like to tell my clients that the waiting room is kind of just for show. My clients are scheduled in 30 to 45-minute intervals on my schedule, so if you miss your appointment, I have 45 minutes to do paperwork. And so you're never overbooked or having to wait for a long time. Now, we do have a chiropractor here in the office, Dr. Brittany Layard from Magnolia Family Chiropractic. If you come to my clinic and you see patients waiting in the waiting room, it's typically her patients because Dr. Brittany is pretty busy. So again, hopefully, if you are one of my clients, you've only just passing by the waiting room. So let me give you a tour of the rest of the place. This is Kelsey. This is Dr. Brittany's receptionist.
Hi.
She's going to meet you at the entrance. This is Beckett and Brooklyn. Both babies were born here. Hi. Nope.
Nothing.
Okay. And so you guys follow me. So down this hallway in the front of the building is where all of our offices are. This is Emily's office. She can't be here today, but this is Emily, my office manager's office. This is where we do all the paperwork and all those fun business parts of our company here.
Did you tell them we're doing a Q&A as well?
Oh, guys, don't forget, if you have any questions during the tour, if you want to go ahead and post them in the comments below. At the end of the Q&A, I'm going to go ahead and do, at the end of the tour, I'm going to go ahead and do a live Q&A and answer your questions at the end. Okay? You might recognize this group. This is Mother Birth. They do placental encapsulation, doula services, and they teach the pretty popular Comfort Measures class here in Lafayette. They actually rent this room in the building. This is Dr. Brittany. Hi. She's treating, she's our resident chiropractor here. She specializes in pregnant women and babies, but she also treats the whole family. In fact, I think this is the first female patient I've seen you have today.
Yes.
We got a bunch of dads today. Follow me.
Courtney says hi, by the way.
Hi, Courtney. Is that Courtney Roy?
Uh-huh.
Hi, Courtney. This is my clinic room. So this is where we're going to spend the majority of our time together. And so as you can see, this is really, really different than your traditional OBGYN room. I do everything the OB does. We listen to heart tones. I'll check your blood pressure. You're going to pee in a cup. But more than that, we really dive in deep into birth fears, getting prepared to take your baby home the first day, and just really making sure that you and your family are prepared to be a new mom.
Someone just clicked that thumbs up button.
Oh yeah. I hope you guys like it because I'm always redesigning this room, trying to make it more comfortable. Because we spend, I think I calculated about 12 to 16 hours together in this room before you deliver. So yeah, you guys can follow me. We also have a massage therapist here at the birth house. She's also not here today, but this is her suite. So she actually starts May 1st. We're getting a different massage therapist. Her name is Lexi. She actually specializes in prenatal and infant massage, and you'll be seeing some flyers soon coming out. She'll be teaching infant massage classes here at the birth house for new moms like you. Actually, my future husband's getting massage here today. So, so again, everything here is not just pregnancy and birth. You know, we do the whole family, so don't let dads be nervous to come in over here and seek our chiropractor or massage therapist. Okay, this is our kitchenette. So moms, you won't really use this space too much, but dads, while the births are going on, we're brewing coffee, we're making snacks. This is kind of where we hang out. And Lane, if you'll turn around, right behind you is our tree of life. So every baby born here gets a leaf. I'm a little behind on my leaves right now. But what I really, really love is that about a year after the birth, on babies' birthdays, moms are coming back and taking pictures with their leaf of their new babies. Now, we have our first 2 siblings, but I just got some phone calls that we're going to be having more siblings coming this year, which I'm really excited about. So, yeah, this is our tree. You guys follow me. part of the birth center is really where the birth house magic happens. Back here, I have the restroom that you'll be using, and I'm gonna show it. I know it's a restroom, but it's a birth affirmation bathroom. Come in here, Lane. I've really tried to take my time to find things that can give you encouragement throughout your pregnancy. And the wall behind you too is just full of birth affirmations. So every time you come here, you get a little bit more encouragement for that natural birth. Because I had this one mom one time ask me if she could take all of these things into her birth suite to labor. So.
Did you do it?
When she was in labor, she changed her mind. Now this is our classroom. So just so you guys know, our birth suites are over here. I don't know if you can really tell through the internet how close this is, but just so you know, if there's a birth going on, if you're in labor, class is either canceled or it's moved to the front of the building if it's a smaller class. Because at the birth house, your privacy is the most important thing, and you're never going to give birth if people are out here doing yoga. So you can definitely be reassured that we have a nice, private space for you. But in this classroom, we have Lamaze. Very soon, Lexi's going to be teaching infant massage classes over here. We're talking about getting hypnobirthing back, which I'm really excited about as well. And so currently, that's what we have going on in here. Follow me to the birth suite.
Remember, if y'all have any questions, feel free to leave them in the comments.
So, we keep a really low client volume so that you can pick the birth suite that you want. Only twice have I ever had 2 moms in labor at the same time. This is the lady suite. And they're really big. And each of our suites with the birth center features a full-size bed, a birth tub, a private restroom, and lots of space for you to be laboring naturally. In addition to all of these things that we have rebozos, we have birth balls, we have birth tubs, we have a birth stool that's kind of tucked away right now, but we have a lot of things to help you keep comfortable in labor. In addition to that, we have an acre of land outside, and so because we're doing intermittent monitoring, which means that I'm using the Doppler and listening to your baby's heartbeat, sorry, you can labor outside wherever you'd like, and I can just follow you and listen to the baby during your labor and do intermittent monitoring for you. So you are not tied down to this room, which is really great. Also, because most babies come at night and on the weekends, you can labor through the whole building. We have the whole classroom. A lot of my moms will just pace the classroom if it's too hot or too cold to labor outside. This is the only suite with a full-size mirror. It takes up the whole wall. Now, I remember when we opened 3 years ago, the little mama was like, "Why did y'all cover the mirror?" But when it came down to her birth, and just like all the other births, nobody really wants to watch themselves in labor. But if you want to, this is the suite for you. You guys follow me.
This suite got a couple of hearts from a few people.
Oh, yeah.
So if y'all like this one better, or this one, I want to see some thumbs ups on this one here.
Right next door to this lady suite is a sunshine suite. And I know this one's going to get a lot of thumbs up, because everybody loves this suite.
Oh, yeah?
Here's the sunshine suite. And so again, it's the same space, it's just a little bit of a different setup. But I have to tell you, this suite makes for phenomenal daytime birth pictures. And so I don't typically have it set up this way. Today I have my stuff out, which I'll talk to you guys about in just a minute about our equipment. But before I do that, let me tell you a little bit about how the births work over here. So when babies are born over here, baby goes straight on your chest, skin to skin. Delayed cord clamping is routine, and in fact, I'm trying to make it a routine practice to not even clamp the cord until the placenta has delivered. Typically, after that, I'll tuck mom, dad, and baby into the bed, because these are really large full-size beds. And for that first hour, my birth assistant and I, we keep the lights dim, and we keep our voices low, and we really try to facilitate the 3 of you having that first hour together really connecting. It's really important that we keep in mind that skin to skin is not literally just skin to skin. It's a bonding time for mom, dad, and baby. And so although we are taking vitals on mom and baby, we really just try to facilitate that first hour. During that time, you'll be breastfeeding. Hopefully everything will be nice and smooth. And after that, my assistant and I will get you up to potty, clean up the bed, and tuck you and dad back in with a meal that we'll have prepared and planned together. And while you guys are eating postpartum, right here at the foot of the bed, I'm going to do the complete head-to-toe newborn exam, the same way that the pediatricians do in the hospital. So what most people don't realize is, as a midwife, I am a newborn care provider for the first 6 weeks. I do administer, if you desire, newborn medications such as eye ointment and vitamin K, and we are responsible for the newborn here immediately after the birth. Now, you've probably seen this on our Instagram or Facebook pages with these cute little scales weighing our baby. That is the responsibility of the dad. So it makes for really, really great pictures. Dads get to weigh their baby and call out their baby's first weight. It's really precious.
Anna said it was hard to decide which one she wanted to choose between the birth suites.
Anna, you should come back for your second one and try out the other birth suite.
There you go. And Kimberly says they're both just too perfect.
Oh, thanks, Kim. So after the newborn exam, of course, baby's typically ready to eat again. Oh, and before I jump into that, just so you guys know, everything is so low-key here postpartum that if your baby is just not in the mood for the newborn exam, he just really wants to snuggle mom, we're going to delay it. There's really no rush over here. As long as everything's normal and healthy, we really just focus on the experience. So, after that, before you go home, you have to eat, you have to be able to pee, you have to nurse your baby and feel really confident doing that. And one of the last things that I'm going to do is inspect your bottom. If you tore, even though you had a natural birth, I do have lidocaine to repair you so that you don't have to have a natural repair. And so what's really good about doing this at this time is that when you're traveling to go home after the birth, which is typically 3 to 6 hours in this practice, the lidocaine makes everything nice and numb, which is really nice for that travel time. So yes, you did hear that right. I'm sending you home 3 to 6 hours after your birth. But don't worry, we spend a lot of time prenatally to making sure you're prepared for this. And because you have my personal cell phone number, we're going to have a relationship. You're going to feel real confident about texting me if you have any concerns. And so I come out, as part of this being able to send you home on day 1, I come out to your house the following day after your birth, and I do a newborn and mother assessment on both of you. On day 1, on day 3, and then you come back and you see me on day 7. So one of the things clients love about midwifery care is the postpartum care. We just spend so much time not only making sure you guys are both healthy, but that you're adjusting, that breastfeeding's going well, and if you need a referral, we'll be able to refer you quickly and directly. So I think that's a big part of why our moms breastfeed so much longer, they have so much higher success rates, is they are well loved and well supported while they're trying to figure it out. Again, if you guys have questions, a lot of times during a private consultation, this is kind of when the birth questions come out. Feel free to post them in the comments below, and I'll get to those in just a couple of minutes at the end of the tour.
And Amy, thank you for sharing this with your friend Amber. We appreciate that.
Thanks, Amy. So you guys follow me to my office, and we'll sit down and talk a little bit about the financial part, which I know you probably have questions about. Follow me.
And we do have one question from Courtney, which we can get to whenever we sit down for the Q&A.
And so when you want to come into care with us, you'll come to your private consultation, which in my opinion, this counts. I want you to have your opportunity to ask questions. After those questions, if you decide that this is still what you like to do, my office manager, Emily, is going to be sending you some paperwork, and it's a simple process, as simple of a process as registering. Now, to become a client, it doesn't matter how many weeks pregnant you are. You can be 6 weeks, you can be 36 weeks. But we do ask that you have had at least one visit with a physician. If you're in your 3rd trimester, obviously I'd want you to have regular prenatal care. But at least one visit with a physician before you come into care. Now, as far as the finances are concerned, we do accept health insurance. We do not accept Medicaid. However, don't let that concern you, because although Medicaid does not pay for the birth center, it pays for all other fees regarding your pregnancy outside of us. So labs, ultrasounds, physician visits. Heaven forbid you're that small percentage of clients that transfer during labor. Told you we have babies here. Heaven forbid you're that one little small percent of clients that does transfer in labor. Your Medicaid would cover all of that, which is great. So we do have finance options available if you have Medicaid and you still want to consider this as a viable birth option. Now on Monday's Midwife Monday video on my YouTube channel, I'm going to be releasing an interview with a midwife, and you're going to see a lot of these questions answered there. Hold on, I'm going to
shut the door.
Sorry. You're going to see a lot of these questions answered. Where was I going with that, Layton? I was talking about, she had asked me. Oh well, you know what? This is Facebook Live and YouTube Live is gone.
You got to go watch the video on Monday, right?
Yeah.
Make sure to go and subscribe.
Okay, so yes, we take insurance. Yes, we have finance options. Yes, we are, oh, that's what it was. We are substantially cheaper than the hospital in most circumstances. And so a typical comparable hospital birth where you show up, no medication, have your baby in less than 12 hours is about $17,000. And that's just for the delivery itself. That's not including paying your physician, your postpartum team, your pediatrician, all those expenses. Comparably, our fee is about $6,000, and that's without insurance. So it really is a huge cost savings, and I'm excited that we get to offer this option at a reasonable price. So, I think that's it for the tour. Normally,
Ready for the Q&A?
Yeah, normally I get that face-to-face interaction, but for now, Lane's going to read off any questions that you guys might have.
So Courtney has a couple questions.
Okay.
Courtney asked, what if baby needs extra help after birth?
Great, that's what I forgot to show you in the other room. So,
You want to go back in there?
no,
Okay.
I can do it right here. Myself and my team that comes to your birth, which is myself and I have an RN who assists, we are NRP certified. And what this means is neonatal resuscitation. We are skilled in providing resuscitation care to the baby, and in the instance of heavy resuscitation, we have the equipment here such as oxygen, bags to bag the baby, and thankfully we have in place a quick transfer agreement in the instance of a true emergency where we would need to get to the hospital. Now, on Tuesday of this week, I had the pleasure of meeting with the head of NICU at Lafayette General, and we're currently in the process of creating a transfer agreement that those rare cases that we might need a NICU, they'll actually come over here and pick up the baby, which is really great. Now keep in mind, this is very rare, guys. Babies are the easy ones at births, but it is here in case there is an emergency.
Great. And she also asks, does family come to watch the birth? And then she says, more specifically, what happens if you're in labor and family and friends show up at the birth house?
Okay. So one of the things we spend a lot of time together during prenatals is to prepare you on how to tell your family not only about your birth desires, but also how to deal with family members who insist on being here. It's a case-by-case basis. In my opinion, as your midwife, you can have however many or however few people you want at your birth, as long as they let me do my job and let you labor. In this environment, most moms want a really private experience, and so I work with families one-on-one to help them figure out how to keep them away. If your family happens to show up in labor against your consent, which I don't think that has ever happened, but if it did, I'm happy to play the bad guy on your behalf and keep them out of your birth suite unless you change your mind.
Great. Trying to see if we have any other questions. If y'all have a question, leave it down in the comments below. If not, we will close out the video.
I also get a lot of questions too. I have a frequently asked questions packet on my website, naturalbirthhouse.com. If you go to frequently asked questions, you'll see questions we get asked. One is, how far away are we from the hospitals? Just so you guys know, we are 6 miles from both Lafayette General and Women's and Children's, and so on day 1 of care, we create an emergency care plan so that we know exactly what hospital we would want to go to in that rare emergency. Now with that said, transfers over here are usually, first of all, they're very rare, and when they are, they're very rarely emergent. Most transfers from the birth house are just first-time moms who are just plump exhausted and they need an epidural. And it doesn't look the way you think it would. It's more like me encouraging them to go ahead and make the transfer so they can get some rest. I got asked very recently if moms ever up and leave over here to go get an epidural. And although I completely respect moms who would want to do that, in my experience, and I've done almost 200 births now, nobody really does that. Once they're in this environment, they do everything they can to stay here. So they get into the tub, they hire birth doulas, and they really just try and stay comfortable.
Ebony just gave you a bunch of hearts for that.
Aw.
And Lindsay asks, what happens or what do you do if mom ends up having complications during labor? And do you call an ambulance?
Very good question. So, we are constantly monitoring mom and baby during labor to make sure they're both safe. If it's a minor emergency, if it's a minor problem that we can fix here, we do. We do have like IV fluids to help with hydration, oxygen, things like that. If it is something that's more urgent, we do transfer to the hospital. I only call an ambulance if it is an emergency and I need to have my hands on mom or baby, or that rare time that I think baby might be born along the transport. So I would want to be in the ambulance to be able to deliver the baby. We do carry also medications for postpartum hemorrhage, multiple medications for that. And we also implement some practices here, such as immediate skin to skin and really good birth etiquette so that mom's hormones can do their job and prevent her from having heavy bleeding issues.
Ebony says you're her favorite midwife.
Oh, thanks, Ebony.
And Jesse asks, can you birth in the birth tub?
Absolutely. So, most of my moms labor in the birth tub and then get out for the birth. Water birth, although I am a fan of it, it really isn't, during the pushing phase. I'm finding that women aren't loving it as much as they love laboring in it. With that said, I know water birth is a huge thing, and I am trained in water birth if that's something you desire. To deliver in the water, you have to agree to participate in something called the MANA statistics. MANA is the Midwives Alliance of North America, and they collect statistics on out-of-hospital births by licensed midwives in the country. To be able to deliver in the water, you have to participate anonymously so that I can offer you that option. And almost all of my clients do that anyway, because we want people to know the truth about the safety of out-of-hospital birth.
Great. Courtney asks, do the laboring moms meet your birth assistants before the birth?
If they want to. Most of the time they meet her during labor, but during the birth. But if I have a client that I feel like really needs to know all the things and all the people, I will have Rachel come in earlier in the pregnancy to meet them. Now, my birth assistant, Rachel, she's my primary assistant. She actually had her baby here. She had our second largest baby born here, our largest boy, at I think 10.4 or 10.5. Rachel, if you're watching, comment how big he is, because I can't remember right now. So Rachel really knows what it's like to deliver in this environment, and she's just the best birth assistant. I'm very blessed by her.
All right. Elizabeth Watts is watching.
Hey, Elizabeth!
And if there's any more questions, feel free to post them in the comments below, and we will get to them. I'm scrolling to go back to see if we missed any.
Well, in the meantime, guys, I'm going to be at the Bloom event this weekend. So if you have any more questions that you're just not ready to ask publicly, feel free to PM me. I'm going to be on the Facebook and YouTube page for the next hour, able to answer those questions right here on the spot. You can meet me at Bloom and feel free to ask me questions there. Or next Wednesday night, we're doing the Truly Natural Talks here back at the Birth House. And that's preparing for a peaceful birth and postpartum is the topic for this month. And I'm going to give a private tour of the birth house afterwards. So if you have some questions you just don't feel comfortable asking publicly, or maybe more personal questions about your particular case, or if you're a candidate, I'm happy to answer those there.
Stevie asks, do you accept VBACs? I had gone to you in 2017, but unfortunately didn't birth there, and there was talk of possibility of VBACs.
Stevie, I am such a VBAC fan. But sadly, the medical board has still not granted licensed midwives permission to deliver out of the hospital. However, I got wind 2 weeks ago that the Birth Center of Baton Rouge is offering second VBACs, which means if you've had a vaginal birth after a vaginal birth after a VBAC. Nope, that's not right. You had a section, you had a vaginal birth, and now you're having another vaginal birth. Sorry about that. That they are providing on a case-by-case basis VBAC services. I am hoping that that will change in the future, but for now, I'm so sorry I can't offer that, and I wish I could.
Right after that question, Adriana asked, "Do you recently posted about being able to do VBACs? How does that work?"
I wish.
I've had 2 sections, and I really don't want those ever again.
Yeah, my thing is that I find that there are VBAC friendly doctors in Lafayette, and I'd be happy to connect you with one of those. And Lafayette General is a great place to have a baby, and so to have a VBAC over there, you really can have a really good experience. I realize it's not midwifery care, however, Dr. Cudahy does have me in his office one day a week, and so if you are looking to VBAC, he's a great doctor for that, and you get to see me a couple of times in your pregnancy.
Great. Let's see. Daniela Rose is watching, and Courtney has another question for us. If y'all have a question, put it in the comments below. Courtney asks, what if you go on vacation or get sick? Who attends the birth?
That's a great question.
It's a great question.
So I am on call 24/7. I never get to go anywhere. I never leave town. I plan my vacations about 10 months in advance. And when I do accept a client who is going to be on call, I'm going to be on call for during a vacation time, I prep them at the consult. Like, here's my vacation time, which, by the way, is next week. I'm so excited. Here's my vacation time. Here's the midwife who's covering for me. Would you like to still use me as your midwife? If I get sick, I also use the same midwife. Currently, her name's Midwife Tammy Webb. But thankfully, we have a really good connection of midwives in the area, and we try to help each other out as much as possible. I don't get sick. That's the rule. I'm sticking with it. I'm not going to get sick. I'm healthy, and I'm going to be there.
Courtney's giving you all kind of hearts for that answer.
I try really hard. You know, the thing that people don't realize as a midwife is, like, you're not another number. Like, I know you and I know your baby, and I'm so excited when you're in labor. In fact, so I don't know if you guys know, but in 4 weeks I'm going to be getting married, and that was not planned out 9 months in advance. I just found that out about 7 months ago. And so I have one client who I prepped her for the other midwife to cover for her, and I told her, I'm taking 5 days off, but if it's not the day of the wedding, I'm still coming to your birth. Like, I can't wait to meet her baby. And so I don't think people realize that. Like, I don't want to go on vacation. I want to be at your birth. Once I've met you, I'm committed. I'm in.
LA said, had my VBAC with him at Lafayette General, and I love him, you, and the entire experience. I highly recommend it all.
Yeah, VBACing is awesome. In fact, I was creating a post this morning for VBACs to go out next week. But Dr. Cudahy is very VBAC friendly, and Lafayette General, y'all, I mean, if you have a hospital birth, it's a great place to have a baby. So don't rule that out if you're VBACing. You do not have to sign up for a repeat section just because you've had a section.
Great. Stevie just has a comment here saying, hopefully soon. Neither of my births were C-sections, thankfully, but my sister's was, and she fully regrets it and her whole birth experience. I've told her amazing things about you and Dr. Cudahy. She's looking into becoming a patient of his since she did have the C-section in 2016.
Yeah.
So
Dr. Cudahy's really, really great. I mean, I don't say that because I work for him. I work for him because he's great. And I know that if you're looking for, if you have to have a hospital birth, or you're looking for a physician because, like, a VBAC, you might need one, he's definitely someone you want to connect with.
Being a dad, just to dovetail onto this, we used Dr. Cudahy, and he was great. He very personable, very knowledgeable, and very soft-spoken.
Yeah.
You know, so I really enjoyed our time with him.
I think he has, Dr. Cudahy, if you're watching this, I'm sorry, I'm spilling your business, but he has, I think, 7 children, and they've all been natural births.
Wow.
So he, and also, I mean, he trained alongside midwives. That's one of the reasons why he's a midwife in his office. So he's really great, and I know you guys will love him. If you're looking for a physician prior to coming to midwifery care, he is someone that you can connect with to do that too.
Lots of hearts on that one.
Yeah, we all love Dr. Cudahy. He's great.
Daniela said, you're doing a great job. So proud of all of the options you have brought to the area. Wish I could move back and have more babies just to birth at the birth house.
Hey, we were goofing off. There's a lot next door. We'll just start a bed and breakfast next door. Anyway, you guys, well, thank you so much for watching. I'm going to be online for the next hour if you have any other questions or comments. And again, if you have some personal questions, or you maybe might just found out you're pregnant and not ready to let anyone know, you can PM me and I'm happy to answer your questions. If you're interested in becoming a client over here at the Birth House, I encourage you to go on our website and sign up to schedule your own consultation. Let Emily know that you've already seen the live tour and maybe you have some questions you might want answered, and I'm happy to, offer my services to you and be your midwife. So thanks for watching. Don't forget to see me on YouTube on Monday. I have an interview with a midwife coming up. And that's it. Thanks for watching my first live video. I survived it, and you did too. Thanks for watching. Bye-bye.